South Florida got a shot in the arm this week with more vaccine supply, more places to get it, and more people newly eligible.
That is all to the good, but there is some confusion about different eligibility rules at different vaccination sites, and some of those rules seem to change day by day, even by the hour. For some answers, we're going to turn to Dr. Aldo Calvo. He is the Medical Director of Ambulatory Services for Broward Health, responsible for managing the vaccine site they run at Inter-American CF Stadium in Fort Lauderdale. Dr. Calvo, good afternoon.
Thanks for being here.
Good afternoon, Michael. Thank you.
We are so glad to see you. First, give us a report. How are things going at your vaccination site?
Well, they're going really well. We actually have 3 sites now. The Inter-Miami CF Stadium, as you mentioned, at Lockhart Park. We also provide vaccinations at Broward Health Medical Center and Broward Health North. We're doing very well. We're trying to provide easy access for those who are eligible for vaccinations, and again, try to get to some sort of normalcy in the near future.
Dr. Calvo, you know, it stands to say things are going very well with vaccines for a lot of people. We in the news report on the problems and what's not going well, and there are a significant amount of people we hear from who are so confused about the rules that are different at the federal sites, different at the state sites. If they show up one place, they don't get the vaccine that they could have gotten if they showed up at another site. Is there a simple answer to that?
I wish there was. I can only talk about Broward Health's initiative and what we've done, and we've tried to make it as simple as possible as a process. So for those who are age 65 and older, for those who are healthcare workers and their staff, for those who are EMS professionals, those sworn officers 50 years of age and older, firefighters 50 years of age and older, K through 12 school teachers and their staff 50 and older, and then those who are 18 to 64 years of age with at least one, if not more, underlying medical conditions. You can go on to our browardhealth.org website and fill out an application for a shot.
So Broward Health has been vaccinating people of all ages, just like other hospitals, for a long time, because that is actually in both the state and federal rules that people of all ages with comorbidities or different underlying problems, doctors have discretions, hospitals have discretion to vaccinate those people. So now we get to younger and younger people. Some of the children's hospitals are administering vaccines to younger people, and there is a lot of concern about that, and especially about the long-term effects. What can you tell us about that?
Well, what I can tell you is that those who are 18 to 64 years of age with at least one, if not more, underlying medical conditions such as hypertension, Down syndrome, cancer, diabetes, they too are at increased risk for developing severe COVID-like illness, which includes hospitalizations, ICU admissions, intubations, and death. They need to be protected, and we need to provide vaccinations in an easy way for them as well.
Yeah. Dr. Calvo, we all know, and thank goodness, the Johnson & Johnson vaccine has been shipped. It's on the market. Do you have it there at Broward Health? Are you administering the J&J vaccine?
We're not administering the J&J vaccine. We haven't received any allotments as of yet. What we are giving is the 2 messenger RNAs, Pfizer and Moderna. So it's a 2-dose, as we all know. And we're providing, upon registration, 2 appointments to get the first and the second dose.
Yeah, let me ask you to sort of give us a macro view. We have seen that on Friday, there were reported in the state 5,900 cases of COVID-19, as opposed to last July when there were 14 and 15,000 cases reported in Florida. Thousands of people were hospitalized. ICU units were really, at the height of the capacity. Things appear to be quite a bit better. Is that true at Broward Health?
Well, I think things are a little bit better with regard to hospitalizations. As of this past Friday, we had less than 100 hospitalizations without our 4 hospitals. We do have other therapies like the monoclonal antibodies that we're providing for individuals with mild to moderate COVID disease. I think that also helps. And of course, the rampant tick of vaccinations as well at our 3 sites. I think that also helps. But the concern that we have, though, is amongst other healthcare systems are the variants that exist now, and particularly in Florida, with the UK variant being predominantly here more than any other state, and what that will look like in the near future. So We continue to implore that the community continue to use mitigation practices of wearing a face mask, some social distancing, of course, and frequent hand washing, and make an appointment to get your vaccines.
I'd like to get your perspective on something that has sort of this political tinge to it. And we're really looking for some facts here. Facts are that the Black and Latino communities are not being vaccinated as high a percentage for the communities as the white community. That's a very general statement, but very concerning to a lot of people where we live. Why is that? Because there has been a concerted effort by the State Department of Emergency Management to put the vaccine into as many places, hard to reach places, as possible. What is the hang up with getting the entire population, race and ethnicity aside, vaccinated at really good numbers?
Well, this is of utmost importance to ourselves as well, because as a healthcare professional, what I want for my patients is great access to care and great quality care. And we know that certain groups, particularly minorities, uninsured and underinsured, healthcare inequities exist. And it's very challenging for these individuals to go to see a physician like myself and get a vaccine or get a prescription to go to a vaccination site and get a vaccine. So we really need to reduce these barriers and provide easier access for vaccinations. And that includes providing more multiple sites, is what we're doing in Broward Health with our stadium site and our 2 hospitals located within the communities, but also partnering with local community leaders in private and faith-based institutions to see if we can provide education, particularly to those who are vaccine hesitant, and provide ample education as well as to the efficacy and the safety of vaccines. I think if we do this in partnership with our community, as we are doing in Broward Health, we'll be more successful.
Well, we hope you are successful with that. So critical. Dr. Aldo Calvo, thank you very much for being with us, and thanks for the good work you and Broward Health are doing.
Thank you, Michael and Glenna. Appreciate it.
Thanks so much.